Hello, this is Oliver Snyder with Team E1 to present our idea for improving the mental and physical health of nursing home residents while maintaining the health of residents and staff. Some background. Although restrictive measures due to COVID are legitimate, they have a significant negative impact on the residents' health and quality of life. Social isolation has increased the risk of depression, cognitive decline, weakened immune systems, and even death. In contrast, social participation is associated with a better quality of life and lower incidences of comorbidities and disabilities in older adults. The implementation of social pods in nursing homes will improve the issue of social isolation by achieving increased connectedness among residents and allow for more efficient allocation of resources for activities. Our approach. When thinking about how to increase socialization opportunities among residents, we considered the following three interaction domains: resident to family, resident to resident, and resident to community. We believe that the creation of social pods of regionally discrete groups that are allowed to socialize freely with less restrictions will increase socialization in all three domains. Resident to resident interaction is encouraged within pods by decreasing barriers to communication and reducing restrictions on residents. To encourage family socialization, we would repurpose areas that are less used in the time of COVID, like parking lots, into family meeting places. Temporary facilities would be built with COVID precautions in mind where residents could meet with families. The creation of pods would facilitate transport to these facilities, allowing for group scheduling. To encourage resident to community interaction, we believe that the podding of residents will allow for events like community choirs and book readings to be provided. Allowing for increased resident density within pods facilitates the allocation of event resources. Our podding procedure, you can see here on the poster, our procedure for introducing members into a pod. For a new member who has just opted in, or for a new admission, or for the first 2 weeks of implementation, podmates must maintain social distancing for 2 weeks and follow all COVID precautions with all interactions. Following the 2-week introductory period, residents will be allowed to socialize with other members of their pod, including reduced mask requirements, eating meals together, and participating in pod activities. In the event of a resident receiving a positive COVID test, all members of that resident's pod would return to the social isolation state and repeat the protocol. For the floor plan of Maplewood Manor Nursing Home shown here, each wing of the complex will be divided transversely into 2 pods for a total of 8 pods per floor. Each pod will contain 12 to 14 patients depending on regional census and whether or not residents opt in. In the image, you can see that there are color-coordinated pods in their respective contralateral positions. Each pod would be paired with their color partner for events that would require pod travel, like meals, social enhancement activities, and group fitness classes, to avoid pod-to-pod exposure. Areas marked by purple shading represent areas that would be designated for pod activities, such as social relaxation time. For activity periods during the daily schedule, a single pod from each wing would have access to the social areas in a schedule that rotates to fairly allocate these areas amongst the pods. Staff members will be assigned to a pod or a small set of pods on a multi-monthly rotation schedule and will change PPE when traveling between pods. This is expected to reduce PPE burn as one set of PPE can be used for multiple residents within pods. In measuring the success of pod socialization, we have divided the measurable outcomes into patient and facility-centered outcomes listed here. The tools we will use to measure each include validated scales for loneliness, depression, and cognitive impairment. The measures of socializing time, hospitalizations per month, COVID-19 infection rates, as well as facility outcomes like overall PPE usage and budget will also be used as metrics of success. This multimodal approach would address multiple facets of morbidity associated with isolation in the elderly. In addition, these measures are easy for staff to evaluate. Challenges to data collection and evaluation include the subjectivity in patient self-reporting, as well as cognitive impairment in some residents due to polypharmacy, medical, or psychiatric diagnoses. The aim will be achieved with decrease in incidence of relevant conditions and increase in overall resident satisfaction. For our discussion, increased socialization invariably comes with an increased risk of exposure to COVID-19. While our proposed method may increase this risk, we attempt to balance patient freedom and autonomy while mitigating the harm of social isolation. Here we give patients and/or families the choice to opt into a rotating schedule for pod-based activities with pre-planned procedures in case of exposures. All efforts are made to mitigate exposure, including assignment of staff to pods and chronologically and spatially optimized transport routes. The pod system not only creates an environment that facilitates socialization among residents, but also allows for incorporation of activities targeted at improving multiple facets of health. In this system, utilization of the interdisciplinary care team allows for activities that improve all physical and social health. Physical health activities such as aerobics, meditation, and PT/OT, and social activities such as bingo, community events, and spirituality are all facilitated. Overall, risk distribution from individual to group risk requires the division of residents into groups, the maintenance of group isolation, and the creation of activities that fully utilize the flexibility that the new group structure provides. Evaluation of the pod system for success will guide the next phase of the QI cycle with the hopes to increase the duration and frequency of pod-related social activities.